This is our client interview. If you could tell your story.
Hi, I'm Abby Murphy. So I was a medical student in Mississippi, and I had a rough sacral spring test performed on my low back sacral region. And after the injury, things just spiraled and got really, really bad. It got to the point where I couldn't function at school. It was becoming harder and harder to sit. My parents eventually had to come pick me up at the end of the semester because I couldn't sit to drive myself home. The pain was that bad. And then when I got home to Tennessee, I saw multiple providers, went to reputable people, reputable orthopedists, physical therapists, who else? Spinal surgeons. So anyway, so I met with multiple healthcare practitioners, but nobody could figure out what was wrong with me. And I kept getting worse and worse. I was having trouble walking. I still couldn't sit. I basically was living in a bed all day, literally all day, just laying in a bed. If someone had told me a couple months ago that I'd be sitting like this again, I would have laughed at them because the idea was so preposterous. But so anyway, so I wasn't getting good care and I wasn't getting better. So I researched a way to try and get myself to get better. I found Jerry. My mom drove me here, and basically after the first or second day, I saw major improvements after the first day, but around the second day is when I saw the biggest change. I was able to sleep a lot better, walk a lot better. This is the second day in a row that I've sat, and this is a big deal for me. So yeah, like my mom said, I have hope now for the future instead of just dwelling, in my bed and being depressed all day and angry and sad. So Jerry got to the root of my problem, and I thank you for that. And I really liked your technique. It was different, like my mom said, different from the other providers that I'd seen. You didn't cause pain. You didn't use force. It was very gentle, very, very gentle techniques, and it didn't take a long time to see a drastic result. I walked in, had a lot of, pain, just barely walking a short distance. And after a couple minutes, you're able to fix it. And that's when my mom uses the word miracle worker. That's, it's just, I guess another way of saying that is it's just amazing how using the right technique, using low force, can accomplish this wonderful thing. I've got my life back, whereas before I didn't think I had a future.
This low force method.
Yeah.
How long is the low force applied?
A very short time, like 2 to 5 minutes.
Which to me is a long time, from my perspective. If you compare that to when your sacrum was injured, how long was that treatment? In school, you had an injury.
Yes.
How long was that force applied that caused the injury?
It was a couple seconds.
Couple of seconds, right? So then 5 minutes is.
It's long in comparison. Yeah, I can see that.
That's my point. That my treatment brings results in the quickly, but the actual treatment is applied for a longer period of time because it's a very, very mild force.
Yeah.
So it does require time, and I think it's the technique that I prefer.
Yeah.
Is low load, long duration, mobilization.
And it's the technique that, I as a patient prefer too. So.
So do you feel like you can manage yourself? Do you feel like you have tools to?
Yes. Jerry taught me techniques that I can use at home to maintain the gains that I've made and to easily keep them. So.
And I think that, with respect to the interview with your mother and yourself, I just want to interject that it's not Jerry, it's a technique.
Yeah, it's a technique.
It's a technique. Yeah. Jerry uses a technique, that he's developed, but so it's more about the technique.
It is the technique.
Than the person.
Yeah, it is the technique, and like my mom said, more people should be aware of this knowledge. More patients can be helped, and quality of life can be improved for more people in the future if this were adopted, and if it were to become mainstream, which I hope it does.
We're trying. We're a small group, and we're trying. So thank you very much. So what will you be doing in September? What are your plans?
In September, I should be back at school. Being on my way to becoming a physician. So.
Very good.
Thank you, Jerry.
Thank you.